Hey there, listeners, and many thanks yet again to tuning in to another Full Circle Animal Healthcare podcast. I'm your host, Dr. Yeager. November is finally here. There are so many holidays and traditions that are already underway, and so many more right around the corner. I know I can't wait to spend some time with family, friends, and of course our pets. What many of you perhaps don't know is that November is also National Pet Cancer Awareness Month. So the same way we humans are susceptible to many types of cancer, so are our pets. Thanks to modern medicine, though, advances in technology, and general preventative care, with or without cancer, our pets are able to live longer and healthier lives. We're able to recognize and diagnose cancer earlier, and we are able to provide better treatment. Today's podcast is to help raise awareness of both feline and canine cancers. Studies estimate that around 11 to 12 million cats and dogs are diagnosed with cancer each year. These estimates are taken from reported instances, either from animal hospitals or pet insurance agencies. We can assume that the numbers may very well be higher than that. Our canine companions have a higher rate of getting cancer than our feline companions do, meaning over half of those diagnoses were given to dogs. The American Veterinary Medical Association estimates that nearly half of all dogs over the age of 10 will develop cancer. Although less is known about cancer in cats, they too are affected in high numbers. Fortunately, though, new research is being performed every day, and I'm optimistic that more breakthroughs that can help pets and humans are right around the corner. Yearly visits with your primary veterinarian are so incredibly important for so many reasons. I know what you may be thinking. Dr. Yeager is always saying we need to make sure to take our pets to a full-service veterinarian for annual checkups. I bring it up in almost every podcast because it is so important, and it is so beneficial for your pet. Even if Fluffy seems fine, having them looked over and having blood work done on a regular basis can lead to early detection of cancer and many other diseases. That early detection is crucial to help keeping your cat or dog as healthy, comfortable, and happy as possible. Cancer in our pets acts much the same way as it does in humans, meaning that it spreads the same way and spreads to the same organs. Fetch a Cure, a nonprofit organization that educates pet owners about cancer and treatment options, explains it well. They explain that cancer occurs when the body's immune system cannot stop cells from replicating at an abnormally fast, disorderly pace, and forming a mass known as a tumor. Just as in humans, companion animal cancer is not caused by any single factor. While genetics and environmental factors can play a role in the disease's development, other variables such as toxins, radiation, and tumor viruses, as well as hormones, can also be responsible for causing several types of cancer. And finally, suppressed or deficient immune systems can increase an animal's risk of developing cancer. There is also some evidence that suggests that pets that are breathing in secondhand smoke have a higher chance of contracting certain types of cancer. There are many types of cancer that can affect our pets. Some of the more commonly diagnosed cancers are lymphoma, which tends to affect cats more than dogs, liver, bone, oral, bladder, spleen, mammary, and testicular cancer, as well as cancer that affects the brain or spinal cord. Spaying your cat or dog significantly reduces their risks of getting mammary cancer, especially when done so before they have turned a year old. Neutering your dog or cat completely removes their risk of getting testicular cancer. Spaying and neutering your pets is highly recommended by veterinarians for many reasons, health benefits being high on the list. If you have or are getting an unaltered pet, always talk to your veterinarian about any questions you may have regarding surgery and ask them when the best time will be to get them scheduled to get fixed. Many times, a pet can develop neoplasia. Neoplasms are sometimes described as a mass, but the mass or tumor is actually the appearance of a neoplasm. Basically, neoplasms are cells or tissues whose growth is abnormal. Sometimes these growths are benign, meaning that they grow rather slowly and they do not take over other parts of the body. Sometimes, though, neoplasms are malignant or cancerous, and they metastasize. They can affect nearly every organ or every tissue of your pet's body, the same way it can happen to your own body. Even though not all neoplasms or growths are cancerous, if you notice a new bump while you're petting your dog or cat, taking them in for a checkup at the vet is the first step you should take. The American Veterinary Medical Association encourages owners to keep an eye out for symptoms that can be related to neoplasia, such as unexplained swelling on any area of the body, sudden weight changes, bouts of vomiting or diarrhea, difficulty eating or breathing, lumps, and of course any visible tumors or skin growths. These symptoms can indicate a variety of illnesses or diseases, so make sure to keep an eye on your pet if you notice any of these symptoms. Or if they are exhibiting any other symptoms, you need to call your veterinarian right away so your pet can receive the best care possible. If your pet were to be diagnosed with cancer, know that there are so many different treatment options nowadays. There are many nonprofit and medical organizations that are making strides when it comes to learning more about how to best go about treating and detecting cancer. Many cancers can be cured, and many can be managed well enough to lengthen your pet's life and to keep your pet's quality of life high. Depending on the severity and the type of cancer, your pet's history, age, and overall health, your veterinarian may recommend many different options, such as chemotherapy, surgery, immunotherapy, and so on. Your veterinarian will also go over possible side effects from various treatment options. More often than not, your vet may also encourage a diet change and different types of therapy to help procure the best possible outcome. If your pet is in pain, getting a prescription to help manage it or keep him comfortable and happy is something that your vet will also provide. I know that even thinking of the possibility that your pooch or kitty cat could have cancer is not a happy thought. But it is important to be aware of the possibility. Again, there are many treatment options now, and with great care and early detection, the outlook gets higher every day. With continuing care and lots of love, many pets diagnosed with cancer go on to live great lives. Remember, always keep track of your pet's behavior, always take them in to see a vet at least once a year for a general checkup and blood work, and talk to your vet about the best preventative care that is available. Many veterinarians advise that senior pets have 2 general vet visits a year. There are also a lot of different options when it comes to veterinary bills. I know those can add up, especially with significant health issues. If that is a concern, I would encourage looking into possibly getting pet insurance to help cover the cost. As always, this podcast is strictly for informational purposes only. Do not hesitate to ask your veterinarian any questions regarding their health or any concerns you may have. We here at Full Circle Animal Healthcare hope that you and your pets are having a great time enjoying this beautiful autumn weather. Give your pets some extra loving from us. Until next time, thanks again.